Pharmacogenetics, also called pharmacogenomics, is an emerging area of medicine focused on understanding how genes might affect individual responses to treatment. As pharmacogenetic testing becomes more widely used in healthcare, it is helpful to understand why you may want to consider getting tested and how it may help your treatment. A pharmacogenetic test is usually done by a cheek swab or taking a blood sample. The results of the test may be useful when selecting a medication or in selecting the dose of a medication for mental health conditions such as depression, substance abuse, anxiety, PTSD, or pain. Let's start by examining how pharmacogenetics might improve your health outcomes. The human body is made up of trillions of cells. Each cell normally contains 23 pairs of chromosomes, for a total of 46. 1/2 of these chromosomes come from each of your biological parents. Each chromosome, in turn, contains hundreds to thousands of genes, which are made up of DNA. That adds up to more than 21,000 genes that we inherit. The genes you have inherited from your parents make up the genetic profile that is unique to you alone. Genes are the basic building blocks of all life. Your genetic profile determines everything, from the color of your eyes to how your brain functions. This may include how your body will respond to the medicines you take and whether you will have side effects. Some medicines could work better with your unique genetic profile, and some medicines might not work at all for you. Genes can determine how fast your body breaks down or metabolizes medicine, and how fast that medicine gets into your bloodstream. Some other genes influence the side effects of medicine. Each person's reaction to each medicine is unique. Your genetic profile may help your doctor select a medication or avoid some medications that may not be a good match for you. Doctors have prescribed medications for decades without this information. Now, as pharmacogenetic testing is becoming more widely available, doctors can tap into information about their patients' genetic profiles when selecting medications. Recently, a Department of Veterans Affairs study called Precision Medicine in Mental Health Care, or PRIME Care, examined how veterans and their providers used pharmacogenetic test results. In the PRIME Care study, about 1 in 5 veterans with depression had genes that could affect how their bodies would respond to medications. For these patients, having the test results available helped providers avoid prescribing medications that would be negatively influenced by a veteran's genes. The results from a single pharmacogenetic test can be used for your entire life. The information is relevant to many medications you may be prescribed, not just those used in treating mental health conditions. Depending on your particular genes, the results may apply to one or more medications, but not all of your medications. If you have had pharmacogenetic testing, share the results with any provider prescribing you medication. Your results may be helpful in planning your treatment. If you are interested in getting a pharmacogenetic test, start by talking to your provider.